A middle-aged male patient of average height and build is lying comfortable on the bed having a pulse rate of the 80 beats per minute. It is regular of low volume and slow rising in character. The blood pressure is 100 by 90 millimeter of mercury with low systolic, normal diastolic and a narrow pulse pressure. The JVP is not raised. There is no cyanosis, clubbing and pedal edema. On examination of the pericardium, there is a visible impulse at the apical area. There is no scar, bulging or deformity. The apex beat is minimally displaced 1 centimeter left the midclavicular line. It is sustained heaving in character. There is a palpable systolic thrill at the aortic area which radiates towards the right side of the neck. On auscultation, the first heart sound and pulmonary component of second heart sound is normal, while aortic component of second heart sound is soft. There is a harsh ejection systolic murmur at the aortic area which becomes loudest during the expiration and it radiates towards the right side of the neck or carotids. There is also presence of early diastolic murmur at the left lower sternal area based here in expiration with the patient sitting forward. The lung fields are clear to auscultation. There are no signs of the pulmonary hypertension. There is no stigmata of the infective endocarditis. The diagnosis is mixed aortic valve disease. The low volume and slow rising pulse, narrow pulse pressure, heaving apex beat, systolic thrill at the aortic area and soft A2 suggested the predominant lesion is aortic stenosis, which should be further confirmed by the echocardiography. An elderly male patient of average height and build is lying flat on the bed having a pulse rate of 80 beats per minute. It is regular of low volume and slow rising in character. The blood pressure is 100 by 80 millimeter of mercury with low systolic, normal diastolic and narrow pulse pressure. There is no JVP, cyanosis, clubbing and pedal edema. On examination of the pericardium, there is no scar, bulging or deformity. The apex beat is undisplaced, lies in the fifth intercostal space medial to the midclavicular line. It is sustained heaving in character. There is a palpable systolic thrill at the aortic area. On auscultation, the first heart sound is normal and aortic component of second heart sound is soft with reverse splitting. There is the also presence of the fourth heart sound. There is a harsh ejection systolic murmur present at the aortic area which becomes loudest during the expiration and it radiates towards the right side of the neck or carotids. The lung fields are clear to auscultation. There are no signs of the pulmonary hypertension. There